What are your chances of getting pregnant after using a birth control method? I have a question here where one of you asked me, "Hello doctor, I started using the 3 months injection 2 years ago. I stopped using it last year in June, but I have not been able to conceive since then. What could be the problem?" Now, I want us to discuss how long does it take to get pregnant after you stop using a birth control method, and when should you stop using your birth control method if you want to get pregnant. Hello guys, welcome to the fertility series by Dr. Raisha. Here we talk about women's health, fertility, and everything in between. If you have not subscribed, please my dear, subscribe and hit the notification bell down below. And so today we are talking about the possibility or the chances of getting pregnant after using a birth control method. But before that, I want you to understand that we have different types of birth control methods. We have the barrier methods, we have the hormonal methods, and we have the non-hormonal methods. And your chances of becoming pregnant or of getting pregnant will depend on the type of birth control method that you are using. The barrier methods are methods such as condoms, diaphragms. The hormonal methods are methods such as the implant, the pills, the 3-month injection. Non-hormonal are such as the copper IUD. And now I want us to look at these methods and how long it takes to get pregnant after you stop using these methods. Let us start with the condom. Now, if you are using the condom as your method of family planning and you stop using the condom, so you're using the condom today, yesterday, all those days, but now you stop using the condom, chances are you can get pregnant immediately, provided that you are on your fertile days. So that is the only problem. Are you on your fertile days or not? If you are on your fertile days, then you can get the condoms that do not affect your fertility. Another method that we have is the IUD. Now, let us look at the IUD. The IUD, we have non-hormonal IUD and we have hormonal IUD. Now, the non-hormonal IUD is the copper IUD. It works by releasing copper ions inside the uterus, and these ions make the uterus a very hostile environment for the sperms. But the hormonal IUD also releases hormones. It releases the progesterone hormones. But with these IUD methods, they do not release hormones into the blood. So the blood is not getting any hormones. And when you stop using it, the body does not need to readjust because they were not affecting ovulation. In fact, a person who was using an IUD ovulates normally. Now, the only problem is that they are creating a very hostile environment while also thickening the mucus at the cervix such that the sperm cannot pass. And if it passes, it meets a very hostile environment, so it cannot get to the egg. That is the only problem. So now, if the IUD is removed, that means now the hostile environment is removed. The roads are clear, and so the sperm can swim towards the egg. And that was the only problem. So if an IUD is removed, that means that fertility is regained immediately, and that is within the first menstrual cycle this person can get pregnant. Another method, let us look at the family planning pill. So what the family planning pill does, we have the combined oral contraceptive, we have the progestin only pills. So they release hormones into your body, and so these hormones, they inhibit the release of follicle stimulating hormone and luteinizing hormone. I made a good video on the menstrual cycle and I explained about all these hormones. And so now these hormones, if they are not being produced, now there will be no ovulation, and hence this person cannot get pregnant. Now the body will need some time to readjust. Most of these people who are taking the pill normally get very light to no periods. And so after they stop taking the pill, now the body needs time to readjust. And so in the process of readjusting, this person may start getting irregular periods. The ovarian function is not restored. So this person is not ovulating, but it is very possible for the ovarian function to be restored within the first menstrual cycle of this person. And if the ovarian function is restored and this person starts ovulating, then they can conceive. But normally, you find that the ovarian function is restored by 3 months. And so these people are advised to wait for the irregular periods now to become regular now again, now for them to start trying to conceive. But women's bodies are different. Yes, they are told that after using the pill, you can regain fertility anywhere between 3 months to 6 months. But for some women, they get pregnant immediately. Actually, we have women who, when they are taking the pill and they miss for 3 days or even 1 day, they are at a very high risk of getting pregnant. So it is possible to regain fertility anywhere between immediately to 6 months if you are using the pill. Now let us look at the implant. Now the implant is a small rod. I talked about the implant in our previous video. The implant is a small rod that is inserted on the upper arm here, the inner upper arm. And so it is releasing progesterone into your body. And as we have said, when we are looking at the pill, the body will need time to readjust. When the implant now is removed, it may take anywhere from 3 months to 6 months to regain fertility. But it is possible even for a woman to get pregnant within 2 weeks or during the first menstrual cycle. Now, let us now look at the emergency pill. Did you know that the emergency pill is also a method of contraception? Okay, it is not a family planning method, but it prevents you from getting pregnant, especially when maybe your family planning method has failed, or maybe if you had unprotected sexual intercourse. Now, if you look at the emergency contraception methods that we have, the Plan B, the Postinor 2, all these methods, these pills usually have a very high dose of the hormone. You could find that they have even 1.5 milligrams. Normally, the normal pills have micrograms of these hormones, but they have a very high dose. And so if you take the pill, this could mean that it could take up to 1 month to regain fertility. But please do not get me wrong. I'm not saying that if you take a family planning pill or an emergency contraceptive pill right now, you will not get pregnant for the next 3 months. No. Every time you have unprotected sex, you should take a separate dose. You should not just say, because I took the other day, I'm not going to take today. No, it does not work like that. But I'm telling you that it is possible for it to give you protection up to 1 month. But it also depends with how you're taking them. Normally, you should not be taking these emergency contraception methods regularly. And if you are taking them regular every time, there are people who take them every week, every day, then this could really affect your fertility in future. Let us look at the Depo-Provera. Now, when we started this video, we talked about somebody who was saying that they took the Depo shots for the last 2 years. They've been taking the 3 months injection. Now, that is a 3 month injection. It contains a hormone that we call medroxyprogesterone that does exactly what the other hormonal methods do. They prevent ovulation. Now, this person is not ovulating. They also weaken the cervical mucus. The cervical mucus is very thick. Now, it will be difficult for the sperm to penetrate. Yes, it provides protection for 3 months. But after now your last shot of Depo, these hormones are not cleared from your body immediately. It might take some additional months for these hormones to be cleared from your body. And in that, this now may make your chances of getting pregnant a little bit difficult. It may delay your chances of getting pregnant by some additional months. It is very possible for a person to get pregnant even on the 4th month after their last Depo shot. But in most women, and research has shown that in most women, it could take even up to 1 year for you to get pregnant. And in most women, up to 18 months. That is 1.5 years for you to get pregnant. So I really hope you are now seeing why our friend here is having trouble conceiving, because since last year June, a year has not even passed. And if you need to get pregnant within the next 1 year, that means that Depo is not for you. And if you are using Depo and you want to get pregnant, you need to discontinue it and choose another method of family planning that you can use as you wait to start trying. it is worth to note that, yes, the method of family planning that you are using could delay your ability to get pregnant. It is also worth to note that women are different. Our bodies react differently. And what one person may regain fertility immediately after using a certain birth control method, one may have delayed fertility. And also, it is important to note that your ability to get pregnant could also be affected by other things such as PCOS, endometriosis, fibroids, a pelvic inflammatory disease. Because if you look at, maybe somebody has an IUD for 10 years, a lot could happen within those 10 years. Maybe you developed fibroids in your uterus during that time. Maybe you had a pelvic inflammatory disease that is affecting your ability to get pregnant. And so it is best that if you are having trouble conceiving, do not just start saying, okay, it is the family planning that is causing this. It is best that you seek medical advice. Go to your doctor, your fertility doctor, your obstetrician. They will run investigations and see if maybe you have an underlying condition. They will deal with that and get it treated. And if it is the method of family planning, they will advise you accordingly. I really hope that I was able to answer that question. My dear, if you like this video, please do not forget to give it a thumbs up. And if you have not subscribed, please subscribe and hit the notification bell down below.